Welcome everyone to our Next Generation NCLEX preparatory series for the Maryland faculty. Just some reminders before we get started. Unfortunately, today we do not have a moderator for the chat, so I'm moderating. So it'd be really helpful if you have a question, if you would please just unmute yourself and ask it rather than putting it in the chat box where I might miss it. So that will be the easiest way for us to move forward. Your audio should be muted to reduce the background noise and feedback if you are not speaking. To complete today, to see evaluation form, to get CEs, you will get an evaluation form following the workshop. Please fill that out. Instructions will be sent about registering for any events. This is being recorded, and the PowerPoint recording will be posted to the website following the event. So without further ado, let's get going. This is how to write case study questions. And I am your host, Desiree Hensel, and those are all my credentials. Disclosure. This educational event has no relevant financial relationship with ineligible companies to disclose. None of the planners or speakers for this educational activity have relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, or distributing healthcare products used on or by patients. And the University of Maryland School of Nursing is accredited with distinction as providing nursing continuing educational credits by the ANCC. You are going to receive up to 1.5 contacts for attending all this activity. To receive the CE, you must submit the completed evaluation that's going to be sent to you via email and complete the acknowledgement section at the top of the evaluation. The nurse will receive a CE certificate via email from the University of Maryland School of Nursing within 2 to 4 weeks afterwards. Okay, I'm your presenter. I'm Desiree Hensel. I started my nursing career at Indiana University. I most recently was dean at Curry College School of Nursing in Milton, Massachusetts. I retired from that role in May, and I am now the CEO of Hensel Nursing Education Consulting. I am a maternal child nurse, so if you think you get a lot of maternal child questions here today, it's just the nature of the beast. I'm a certified educator and a certified simulation educator, and I do research nursing education. I co-edit Lippincott Q&A 13E with Diane Billings. So this session, we're going to use a case study and appropriate test items for each of the clinical judgment steps, and then we're going to get an opportunity to practice writing questions using a template for an entire case study. After engaging in the sessions, you'll be able to write test questions for each step of the clinical judgment model and write a case study with test items for your course and analyze and construct appropriate use of test items based on a case study. I'm not going to spend a lot of time on this because you have seen this many times over by this point, the clinical judgment model. This is the most current iteration of it. It has been published 3 different ways since its beginning. So when they tell you that nursing judgment is an iterative process, so has it been creating the clinical judgment measurement model. It was, I believe, is the most current term we are using. It is designed to test clinical judgment and decision-making in large scales, high-stakes settings. It supports NGN item development, and it can be adapted for teaching. If you've been to recent sessions, you've probably already heard about the test plan, but I'm just going to talk a little bit about the test plan. The RN and PN test plan will be similar in that they will be the same number of questions and they will be the same length of time, unlike the way that it currently is. We are anticipating that the rollout of the new test plan will be April 1st of 2023, although beta testing is going to take place next year. The variable length computer adaptive exam is going to be a minimum of 85 questions and a maximum of 150 questions, of which in the first 85, there will be 15 unscored items. Those 15 unscored items can be a mix of standalone items or cases. Within the first 70 graded items, every student is going to get 3 cases that are 6 items each, or 18 questions. During the time that a student is receiving those cases, the exam does not adapt. So those questions are always associated with that case. Students will get a case early in those first 85 questions, midway through those first 85 questions, and near the end. Now, some students are going to get more than the 3 cases, but those would be the as part of the ungraded items, and they're not going to know which cases are graded and which ones are not. After 85, the only thing students will get are standalone items, and the standalone items can either be our traditional knowledge items, or they can be standalone trend or bow tied items to test clinical judgment. We know that the test is going to be 5 hours. That's 300 minutes, and their cases are not really expected to take a lot of extra time. So we're still talking about students have about 2 minutes per question. So planning a case. You have already had one workshop on writing cases. So anything that, if you attended that workshop, I'm not trying to contradict anything that was said at that workshop. This is just one more way to go about things. In general, cases are always information presented as an electronic medical record, and they can have from 1 to 6 EMR tabs. So the EMR medical record tabs. Cases unfold. That means new information can be added at any point and is expected to be added. They always have 6 questions, 1 for each clinical judgment action in order. So the first question is always going to be recognized cues. The next is always analyze. The third is prioritize, generate solutions, take action, and evaluate outcomes. They like to cue people into seeing the lead-in statement of the question by presenting an arrow that I'm circling now. So, approaches to creating a tech case. You want to develop a client care situation an entry-level nurse may encounter. High frequency things are perfect. Low frequency but high risk are also great. I would avoid things that are low frequency, low risk. They're probably not your best cases to test clinical judgments. You may start with an existing case, so a textbook case. Simulation scenarios are wonderful places to start, or you can use a template to build a case. And I know that there is one available to you on the workforce development site. You also, if you are getting the NGN newsletters, you would have seen what I've got pictured to the right about a template that the National Council has suggested. I'm going to tell you the way I go about developing case is I first start with relevant context. So remember, context is layer 4. Clinical judgment is layer 3 of the measurement model, those 6 steps. But context is layer 4, those other things that influence our judgment. Typically, I would start with, where is the care setting? Is this and I'm going to present to you a case where it's a school. Then I would go on and I would identify your client. So who is your client? In this case, I'm going to make a 9-year-old male. You may add race or culture if it is central to the case. However, be mindful you do not want to add race and culture if it is stereotypical and not relevant to the case. Then you want to go on with some client symptoms and duration. And in the case I'm going to present, I've got a sweaty and confusing client that is in gym class. Excuse me, let me go back. I just got rid of my case and I need to go back here. Collapse the chat. Okay. There we go. Then you want to talk about the client's symptoms. Then you're going to add on any significant history, like medical, social, family. From there, you can add some objective data like vital signs, physical findings, and diagnostic text. You may want to add if there are others present. So I've got the layout here of the case I'm going to present to you first. I'm in a school. I've got a 9-year-old male who's sweating and confused in gym class. He's got a history of type 1 diabetes that takes premix insulin 30 regular and 70 NPH twice a day. His last dose was 3 hours ago, and the gym teacher brought him to the nurse. Now, that stuff is what I'm going to start as more relevant. Then, because we are trying in step 1 to distinguish what is relevant versus irrelevant, it's important that we add a couple of those details that are less relevant. So here in mine, I've added that the client was sick yesterday and missed school. He needed some extra insulin yesterday, and his last blood glucose was 120 before breakfast, and that was several hours ago. So remember, start with what's relevant, and then you want to add a little bit that's not relevant so that your first question makes sense and students are determining what's relevant and not relevant. Okay, caution about patient characteristics. You can add things like age, sex, gender, identity, disability, socioeconomic status, native language, country of origin, ancestry, or occupation are sometimes added, but you want to do this not automatically. You want to do this in a thoughtful way. Just because you add characteristics to a question doesn't make it about culture or diversity. Just saying that your client is gay does not make that a cultural question unless it is about specific care of that particular kind of client. So as you think about adding characteristics, this is what you want to focus on. Characteristics should be clinically relevant or improve distractors. So, in this case, if I'm trying to ask a question about childhood development and I'm trying to see what a client does at age 18 months, they're very different things that you expect out of 18 months and 12 months or at 2 years. So that becomes very relevant to find out whether something's normal or not. You want to add characteristics that are necessary to understand why the patient is being seen. So a client that has a physical disability may be being seen because they need help with their assistive devices. Add characteristics to increase the probability that the nurse will recognize a client condition, especially if the condition is rare. And the one I like to think about is Tay-Sachs. I'm a pediatric nurse, and that's fairly obscure to most people. And you may not even come into your awareness if you didn't know that the client might have had some kind of Jewish ancestry. You might add characteristics that require a different approach to care. So definitely a transgendered client requires gender affirming care, or clients that don't speak a native language, English as a native language, might need an interpreter. What you don't want to do is add characteristics that perpetuate a narrow negative stereotyping. So you can say a client is homeless without adding a lot of other detail. It's probably enough to that. You don't have to say it's a Black homeless client, which would make it very stereotypical. Okay, so what are you going to put in your EMR? Then things like age, gender, care, environment, presenting symptoms, duration, physical findings, diagnostic tests if applicable, maybe treatments that have been tried, any family support that's present, initial treatments maybe too that were ordered. You're going to come up with your EMR pages that you're going to use in your case. So you can have up to 6. Typically, pages people pick from are nurses' notes, history and physical, laboratory results, vital signs, admissions notes, orders, intake and output, progress notes, medication, diagnostic results, and flow sheets. That's not meant to be all inclusive, but those are the most common ones that they're seeing and the ones that the National Council has listed when they talked about tabs that you might see in the standalone and standalone bow tie and tread items. You can have all of your EMR tabs present at the beginning, which is not as common as adding them as the cases unfold. And you can do an entire case with just one page, and that's how we're going to start. We're going to show it simple. The first question, though, you do need to have something that's a good overview of your patient, like nurse's notes or admission note or history and physical. Please remember that the amount of information needs to be reasonable on any page. So you don't need to put every single aspect of a lab value, you know, a chem or a basic metabolic panel. I maybe not need all parts of it. I may just need to put a few parts of it. You don't need, when you look up post-op orders, I might not need every single post-op order that you might see. You want to put the ones that are relevant to the case. Narratives need to be short paragraphs. If you're getting too much information on a page, you probably need more pages or to break it up. There is queuing added to the right whenever new information is added, and I'll show you what that looks like. And please know the care setting can change at any point. So you can start in the outpatient clinic and you can be about admitting the patient to the hospital. And then you can have a time lag and you can follow up at home a week later. So it's okay to do that. So the basic way you're going to set up your case is several key elements. There is always an introductory statement at the top. And this is just an overview of your client. The nurse cares for an older adult in the clinic with hypertension. Now, this statement may change. When I first started writing cases, I was not clear whether or not this statement could change, but they have clarified at the NCLEX conference, yes, you can change the statement. So if you start out in the hospital and your settings changes, you can change this setting to make sense with your case. Far to the left, there is always going to be queuing that shows this is a case study, and it's going to show you what number of the question you're on. So here I'm going to say we're 1 of 6, and then the next one would be 2 of 6. The EMR is going to align on the left, question will be on the right. I'll show you that as it comes. The way the National Council is going to do it, and it may not work for you, is that the open EMR page is going to not have a line between it and the text. So here, this is white and down below it's white. That may work for you. It may not work for you. Here I'm showing you that maybe on the next question, I would go up to case 2 of 6. I may need to add pages. It is very typical. It is very, very typical to start with a certain number of pages and then not add new pages until after question 3. It's not, you certainly can add them before, but it's very common practice to let people get through the first part of the clinical judgment model, get them up to what they think they have a hypothesis, and then after they've formed a hypothesis, to provide new information to them. If you are going to show a lab value, this is a new rule in NGN, you have to show a reference range. So please make sure that any labs that you want to do, you have include the ranges. And remember, you don't have to have all aspects of a normal lab panel. We use military time. So this is an element of style for NGN. You can have military time, which might be the started case is time 1. You can add time 2 that might at any point in time on the same page, or time 3 or time 4. So just be aware, you can add information at any point in time. When I tab across, I open up new pages. So that's how the student would get it. So let me go back. I click up at the top and a new page order opens up. Now I'm going to tell you the testing system that we were using did not have the ability to do that. Pearson VUE does. So what we have to do is present all pages available to our students in the question. So it may be setting up your, and I'll show you an example of what I mean. That's the best way to go about that. So case will be to the left, question is on the right. Now the arrow is always going to be the lead in, the beginning of the actual question, but it is okay to have some statements above the arrow that cues the student that maybe there is something that they need to go back and look at on the left. So the column might tell them there's new information to consider. The physician has just written orders, or something, the client does receive the diagnosis of preeclampsia, something like that. It is okay to put that on the right before the question. Okay, so that is the basic overview of setup. We're going to go into the questions, and if you're joining us late, just please understand that we don't have a moderator today. So if there is a question, the best thing to do is to unmute yourself and just speak right up, and I'll try to be as prompt as I can about answering. Okay, so moving on to 6 questions. You're going to determine what actions you're looking for. It's important to remember that you are testing entry-level nursing knowledge and skills. You're looking for specific actions nurses should take, because remember, if you look at the definition, this is an observable, it's an observable behavior. Consider you can still link these to the activity statements from the detailed test plans. And if you haven't looked at your detailed test plan in a long time, boy, here I would go back and do it again, because it's a great place to get some ideas about entry-level questions. We've got the RN and the PN, and remember, both RN and PN will be tested on clinical judgment come 2023. So ideas, we can have, for a PN, they don't have management of care, they have coordinated care. If we look at activity statements, and one of us provide information about advanced directives, perhaps for question 5, the STEM might be, what information should the LPN VN provide to the client about advanced directives? Participate in data collection. What additional data should the client gather next? This could be a step 4 question. Which provide information to supervisor when a client assignment needs to be changed. What findings should the LPN VN report to the supervisor immediately? So these are some things to think about. You can do the same with the RN management of care. It's different activity statements because it's a different role. We've got on the one side, perform procedures necessary to admit or transfer a client. What information should the nurse confirm before discharging the client? This could be a step 5 question, and it could possibly be a step 6 question if you're trying to evaluate outcomes and wanting to see if the client has met discharge criteria. Definitely a great question for number 5 is assigning and supervising care provided by others. Which tasks should the nurse assign to the unlicensed assistant personnel? Great number 5 question. So what do you ask each time? Question 1 is always about recognizing cues. I've got all the actions listed, but we're asking ourselves, what matters most? What is abnormal? What is serious? What is urgent? Which assessment findings need immediate follow-up? And this is a really good question. You're going to see that one come back over and over again. Which assessments need immediate follow-up? What top findings require further investigation? That's another one that you're going to see over and over again. Question 2, you're clustering the data, looking for patterns as you analyze the data. You're asking, what could the findings mean? Which client findings are consistent with a specific disease or problem? Which factors does the client have for a specific disease or problem? What potential issues is the client at risk for developing? What are the possible problems or conditions the client could be having? What additional information would be helpful in interpreting the findings? Or why is something concerning? When we prioritize a hypothesis, we are getting things down to one thing, determining what is most urgent or the most urgent priority. And you can provide rationale for this. Sometimes it's a little confusing to people whether it's between step 3 and step 5. Step 5 talks about what action to address first, whereas step 3 is more talking about what problem to address first and a little broader. So questions to ask. Where should the nurse start? What is most likely happening? Which condition is the client's highest risk and why? What is the top complication the client is at risk for developing? Which problem should the nurse address first? And what will happen if the nurse fails to take action? Now, these questions typically include phrases like most likely, greatest risk, highest risk. Remember, we are still not asking our clients to make a medical diagnosis, but we spend years and years and years teaching our students about diseases and what to do to how to care for a client if they have them. So it is only natural that when we see these, we can ask our students what most likely is going on and expect them to be able to answer that question. Question 4 is creating the plan of care. We determine the outcomes. We select the multiple appropriate interventions. And here you want to also talk about, is there anything you absolutely shouldn't do that's going to be harmful to the patient? You can gather more information if needed and determine who else you might need to participate. So questions: what can the nurse do? What is the best client outcome? What interventions will achieve the desired outcome? What additional information should be gathered? What potential interventions are indicated or contraindicated? Which orders are anticipated? Take action is implementing the plan of care. It's things like requesting a prescription, performing a skill, administering a medication, protecting the family or client, collaborating with team members, delegating, communicating, teaching, and documenting care. The one thing the National Council has told us at the last NCLEX conference in September is this specific question should not focus on steps that you can find outlined in your textbooks. So an example is you will have maybe written questions, at least being a pediatric nurse, I know that I would write drop and drag questions, ordered responses, where I talk about the steps to use an inhaler. This is not what they're looking for. They're wanting you to use things that are going to require judgment. So you're going to be pulling things from different pieces of the information. Maybe they read about asthma and you're going to talk about using inhaler, but you might have to take different informations from different parts of that chapter. They're not just going to be listed in order that students can memorize. So you're asking, what will the nurse do? What action should the nurse take? Which interventions or orders should the nurse implement immediately or first? Which interventions should the nurse delegate? What steps should the nurse take to administer or a medication or perform a procedure? What should the nurse teach the client? So the last thing that we talk about are the evaluating the outcomes, and that's pretty self-explanatory that we're going to compare our desired outcomes to the achieved outcomes. We're going to recognize changes in our client's status, determine if our actions have been effective, and if there's more now that after we've done our interventions, more we need to follow up on. So questions: did the interventions help? What was the teaching understood? Which assessments finding indicate the client's condition has improved, stayed the same, or declined? Which assessments finding indicate the client is not progressing as expected? Which assessment should the nurse make to determine if the treatments were effective? Which findings suggest the client is ready for discharge? So these are all things that you can ask. Okay, so if you were with me for the last presentation on the 22nd, we talked about that there are new item types, and I can tell you specifically that there are 13 case study item types that you can use to write cases. One of them is an old friend, multiple choice, and two of them feel sort of familiar, select all, apply, select N. You can write an entire case just using those item types, and that's what I'm going to show you to do first. There is no set rule about how many item types you have to use in a case. So just to get you started, sometimes you might want to start easy and add on as you get more comfortable, and that's kind of how I'm going to recommend you move forward. I do have included a table. We went over this last time about some ideal questions to use for different steps of the clinical judgment model. Recognizing cues, really you want to select all, apply, select N, or a highlighting question, because you're not asking them to make any judgments, only to say, yeah, that's not normal, but not really why. So those tend to work best. When you go to analyzing cues, you have a lot more options, and matrix questions are really great here, as well as rationale and close. Here, highlighting is not good because it's not asking you to make any judgments. You're just saying, why did something happen? When you prioritize a hypothesis, you're wanting to get this down to really one thing. So this is a place that select all, that apply does not work well, or matrix or multiple choice. I mean matrix or highlighting or multiple response. Multiple choice does work well here though. Generating solutions, grouping works well. Select all, that apply, select N, multiple choice matrix. I have a hard time doing a multiple response matrix here. I've just never been very successful at it. Maybe someone else can be more creative and think of a way to do it, but I've not had much luck with that particular one. Multiple choice questions are probably not ideal for this one because they want you to generate the multiple possibilities of multiple things to do for the client. Take action is pretty wide open to how you answer it. As far as the evaluate outcomes, I would avoid the multiple response matrix again, but other things work pretty well. I have a review of the scoring rule, and I'm just going to leave that there for you. Remember that this is the rule the National Council is going to use. It does not necessarily mean that it makes sense for your program to do that. You need to come together as a program and decide how you want to score items. Okay, so I'm going to start as simple as I can. I'm going to start with my first case. I'm only going to have one EMR page. I'm going to add information to it a little bit, but I'm not going to add any new pages. And I'm not going to use what I call the technology enhanced items. So the only thing I'm going to use for this entire case is I'm going to write it with one page and use multiple choice questions, multiple response questions. Okay, so here is question 1. And I am using a 9-year-old child with a history of type 1 diabetes is brought to the school nurse's office. You can see I have set this up so that I've got my case study screen 1 of 6. I've got my nurse's note open. I don't have anything else. I've got my case here in military times. The student was playing basketball when the teacher noted he became sweaty and confused. He was out of school yesterday for flu-like symptoms, but came to school today when he was afebrile. The student has a 3-year history of type 1 diabetes. He manages with 2 planned injections a day of premix 30 regular and 70 NPH, which he took at 0600. He takes an additional regular insulin as needed. His blood glucose was high yesterday when he was 6, and he needed 2 extra doses of regular insulin. This morning, his blood glucose was 120 milligrams per deciliter before breakfast. His target was 80 to 130. Now, I put in the target here because the National Council says you're supposed to include lab values. I will tell you that at the NCLEX conference, they presented a case to us where in the narrative they had a blood glucose and they did not include a normal range. So I think that that is the one value that they think is pretty much like a vital sign, and they would expect students to probably recognize an abnormal lab value. So let me start with our question 1, which I have a multiple response select N, which means I tell them how many to pick. So here I've got which 3 client findings are most significant. In a multiple response select N, the way they set it up is that it is worth as many points as are keyed correct. So this particular question would be worth 3 points. Case screen 2, I've added no new information. My question is, which factors best explain the client's findings? Here I have put in a regular multiple choice question. I could have broken this out and made it a multiple response and put increased insulin and illness all on different lines, but I decided that I wanted to present it this way. It's still recognizing patterns, so this is a step 2 question. Still no new information, and I am going on to step 3, which is prioritize hypotheses. And I've asked, and I'm sorry that it's a plural here. I didn't get this corrected. You should say which problem is the client most likely experiencing versus problems. I apologize. Again, I've got a multiple choice question here, and it would be worth 1 point. Now, we have gone on to step 4, and I tell you, it is very common around step 4 to add a little bit more information, step 4 or 5. Here I have added some more information. I added a new time point. I have cued the student that there is some new information by adding the sentence at the top, the nurse obtains a blood glucose. And so that cues the student to go back and to look over at the case. I didn't say over here that what it was. I'm making them go back and read it off the case. Now I have gone on, this is screen 4, and it is our generate solutions. Which interventions are indicated? Select all that apply. And again, remember, for our select all that apply questions, the number of points it's worth is the number of correct responses. And here I have 3. Going into 5, it is very specifically how I am going to take action. So I have not added any more information here, but the nurse prepares to give the client a simple fast asking glucose. Which option would be appropriate to give the client? And I have listed some options here for my select all that apply. And I have 4 correct options. And I think I said, again, this one, there should be 4, it's got 4 correct options. So it has a possible 4 points versus 3. You look at these a million times and think you're going to get it right. So just make a note on your slide. Okay. And finally, now I've added some more information. The nurse treats the client with 15 grams of glucose, and I now have a new time point. The blood glucose is 65 milligrams per deciliter after drinking 6 ounces of orange juice. Reports a headache, but speech is slurred, refuses to take more fluids, twitching noted in extremities. So which findings would indicate the client is developing severe hypoglycemia? Select all that apply. So you can just see, I have gone through an entire case, clinical judgment case. I've used 1 EMR page And I've used types that would not be unfamiliar to your faculty writing the questions or your students taking the questions. So it gets fancier from there. So let's move on to another case example. And this particular case is going to use more pages. And we're going to introduce more technology enhanced types. So I cannot, in my learning management system, I am not able to tab through the pages the way that Pearson VUE is able. I'm able to click and open a new page, so they only see one page at a time. I can, however, and this was set up in Canvas, set it up so 2 pages could display for my student, and that is how I am showing it here. Here I'm starting out with a select all that apply question for the first step. The nurse is caring for a client admitted to the ward from surgery following long cast placement for a right upper tibial fracture. And I have a nurse's note with 2 time points, and I've put the vital signs on a different page. The next question is for each client finding, click to specify if the finding is consistent with the complication of compartment syndrome, deep vein thrombosis, or hypovolemic shock, all things that a new nurse might think that this client could be experiencing. This is set up as a multiple response matrix. I have it queued that each finding may support more than one complication, and each column must have at least one option selected. So I have 1, 2, 3, 4, 5, 6 here. So 7 possible options. So it would be worth a possible of 7 points. Moving into case study screen 3, again, I have not added any new information. I'm asking them now to complete the sentence from the list of drop-down options. So I am using a drop-down close. Close is another word for complete the sentence. So by and they can, drop downs can be one of 3 types. The close is to complete the sentence here. I actually have 3 sentences. They will first show as the word select, and then when you click the select, it will open up to show you your options. The number of points are the number of boxes. I've not added new information over here, but I have told the student that we have the nurse notifies the surgeon about change in condition, and the orthopedic surgeon wants to attempt conservative treatment. For each possible intervention, click to indicate if the intervention is indicated or not. This is a multiple choice matrix, and the number of points equals the number of rows. Now, screen 5, I have elected to add more information. Here, I am doing a drop-down table, and I have added orders. I've said that the client's condition does not improve and undergoes an emergency fasciotomy. The client returns to the ward with new post-operative orders. And so I have cued the student that there's something new to look at over here. I've got some orders here, but I don't have complete orders because it would be very difficult to give a student every single post-op order that they would expect to see. Here I am got a table, and they would expect to be select the correct information here based on what we would anticipate setting a PCA pump up. The number of drop downs are the number of points possible in this question. Now I'm moving to 6. Now I have added more information here, and I've got the nurse assesses the patient the day after a right tibial fasciotomy for acute compartment syndrome. On the nurse's note, I put in that time lag because the beginning information is not as pertinent at this point, and I'm just going to start with this time lag post-op day 2. I've got vital signs for post-op day 2, and I'm now added some lab values. Here I have a drop and drag rationale question. It is a triad question, so it is 2 points possible. They get 2 points if they get the cause and 2 effects correct. So that is an example of using a technology enhanced items with, and I'm going to show you one more. I'm going to go through it quickly so that we have more time to work in our breakouts. If you are going to do a highlighting question for question 1, this is one of the exceptions to the rule they told us about questions being set up on the right. The National Council has told you that if you put this on, you're going to highlight on this page, you don't have to put it on both sides. So it is okay on those highlighting questions to just present it on the left and not have to duplicate it to the right. I have a nurses caring for a 25-year-old primate gravid client at 36 weeks gestation. Click to highlight below the findings that need immediate follow-up. And here I have the item shown with it showing how many options were be available to the student to select from. I'm not going to spend a lot of time on the item writing aspect of it. Please go back to my previous session if you want to have more details about how to set up tokenized highlighting items. For the next question, we're saying for each client finding, click to specify if it is most consistent with the diagnosis of mild preeclampsia or severe preeclampsia. So this is a multiple choice matrix and where they analyze cues. Number 3 is the prioritize the hypothesis. I'm going to have them drag the word choices to fill in the blanks of each of the following question. This is a drop and drag close. There's one set of word choices, and we would say the client most likely has severe preeclampsia and is highest risk for a seizure. Step 4, again, I've not added any new information here, but I'm going to add the client's transferred to the labor and delivery unit with the diagnosis of severe preeclampsia. So I could have put it to the other side and change the statement there, but I'm cueing the client over here that we now have a diagnosis. Select the anticipated provider orders from each of the following categories. Each category must have one response. This is a multiple response grouping question that works really great for number 4 questions. Notice here, I have now updated my statement. The nurse is caring for a 25-year-old primate gravid client at 36 weeks gestation on the maternity unit with severe preeclampsia. So I have now adjusted my case because she's no longer in the outpatient clinic. I have provided orders. I have cued them that the nurse receives orders to administer mag sulfate, and these are which steps should the nurse follow to administer mag sulfate. This is a select all that apply. And again, these are things that you would not necessarily see in an exact order, but they are things that would involve clinical judgment about giving that high-risk medication. And then finally, I'm coming to the last question. The nurse has implemented the treatment plan and reassesses the client. So here I have added to a nurse's note with a new time point. I went ahead and put it to the right for a highlighting question. It could be over on the other side, but I want to be able to clearly see my orders. So that's why it's appearing on this side. And I have shown you the correct answers. So before we break into our breakout booths, and we're going to do this, quickly. I'm going to say, if you want to unmute yourself, I'm going to quickly go through a couple questions, and I'm going to see if you think that there are some problems with these questions. So look to the left, see what number of clinical judgment step it is, and think, is this question really the right one? Is the question set up correctly? Does it make sense? What other problems might you see with it? So let's look at this question. Okay, this is case study 4. Which intervention should the nurse anticipate incorporating in the plan of care? Select all that apply. So do we think this is a step 4 question?
Yes.
Probably yes.
Mm-hmm.
What do you think about the interventions? Does anybody have any comments about the setup of the question?
Can I ask you a question?
Sure.
Give me 1 second. I'm on two computers.
Okay.
So,
Okay, while he's getting it ready, the one thing I might mark out is notice that this question actually has too many options. Remember, the most options we can have is 10. Okay.
For a question like this, would it be better for the student if we group them, like the activities, the meds, or whatever, or is a long list like this just as preferable?
It can be either way. So let me just say that it's going to, what I'm going to tell you is your grouping is going to depend on whether you have the ability to do grouping set questions. It is absolutely fine to do it as a multiple response question. If you're going to group them, does your testing system have the ability to do that yet? And maybe it doesn't today, but it would in the future, and you could move towards that in the future as it became available to you.
Great, thank you so much.
Mm-hmm. Okay, let's go to, yeah.
Can you hear me now, Ms. Hensel?
Yes, I can.
Okay, I apologize for that. I have seen on several of the questions regarding the pharmacology and the dosage. Is the student required to know the exact dosage on certain medications, or
they should be able to recognize really bad doses? That would be my answers to you, and that's what we've heard from the National Council is they should recognize dose ranges. I mean, basically, I would want my students to know if I gave 100 milligrams of morphine to my client, I'm probably going to kill him, that kind of thing. Okay. And if I give him 0.1 milligrams, I'm not going to help him.
So we're talking mostly with the extremes, like either very low or very high kind of thing?
I would say that would probably be most likely, yes, that they should recognize.
Okay, thank you. Okay.
One more question.
Sure.
If you don't mind. I have the most difficult time deciding what to put on the contraindicated and the not indicated, because my brain goes to the, what are you going to do? Right. So that person who asked you about the medication, would that be a good way to do the contraindicated one?
Sure. I mean, that's a great way to do it. I think about a dose that would be way too high. Yeah, that would be administer 100 milligrams of morphine. Yeah, that would be one way to do it.
Great.
Dr. Hensel, this is Sonia, and there's a question from Sabrina. I don't know if it's been asked. She said, can you clarify difference in number 4, generate solutions, versus 5, take actions? Okay, so it's just like the nursing process. When you write your care plan out, how you're going to do it, and it's just a general intervention. You really talk about general interventions here, but when you really get into the specific way that I am going to do it, the micro details of how do I give a medicine, because in your care plan, you're going to say that you're going to
give a certain medication, but when you go to how you're going to do it, it's halving the prep of it. You know, magnesium sulfate was a perfect example. So it's more detailed in the actual how you go about it. And teaching could be another one. It's maybe your care plan would say, teach the client about home medications, but in the action plan, you're going to put every single thing you're going to teach them or not teach them. Okay. So some other issues with this one, there are typos in here. And so, you know, typos are definitely things that you need peer review. So to make sure that you're not having a lot of those. Here is a question. The nurse cares for a client with suspected abuse. This is supposed to be one of 6. Select the 3 findings that need immediate follow-up. I would say this is a step 1 question, but if you're going to do a select and question, remember you have to have at least at least 5 options. So this doesn't have enough options. Just like now, if you do a select all that apply, you have to have at least 5 options. That's the minimum going into this, but the maximum goes up from 6 to 10. Miranda, yeah, you got a question for me?
I do have a question. Well, actually 2. First of all, with these questions, is there any recommendations on times? Would they need more time to work through the questions? So that, I mean, how much time are they estimating to work through by the time they have to read the scenarios? And then the next question is, as you're implementing new items, has there been any suggestions in terms of looking at your p-values and point by serials when you're looking at your analysis for the questions?
Well, here's the problem with p-values. And you can do a p-value, but your point by serials, remember, point by serials, you can only do it with right and wrong questions. So the way I would work with this till now, until they come up with more specific, until you get more specific, is number 1, National Council always starts with a peer review. I would never do this without a peer review. So I would start with that. If you can pilot test things as ungraded questions first, that's best. I would look at your p-value or the percentage of that students got it right, but you're probably giving partial credit on these questions. So the average score for that question, and then I would go through every distractor and I would make sure that every option is always used and that there is no option that is incorrect that is used more often than the correct option. And that's how I'd start for now.
Okay, yeah, because I know ExamSoft, I don't think you can get p-values for each distractor, but I know you can get percentages.
But you should be able to see if there was, you won't get it, you should be able to see how often the distractors were used. I mean,
Yes,
yeah, that's what you're going to be looking for to make sure. Yeah, you want it. That's how I would start with the analysis. Okay, and then I'm going to go on because I do want to get us into our groups because I think the activity is going to be helpful today. The nurse cares for a client. This particular question is supposed to be 6, but this is not a 6 question. If I'm going to educate the client, I could ask if the teaching was understood, but if I'm going to actually educate the client, it's a number 5 question. Okay, so this is our group practice, and Sonia is going to put you in a group. So what I want to tell you, and I'm hoping that this is going to be really helpful today. When you signed up for this class, you got the option of going into one of 2 cases. The first case is a 19-year-old with a ruptured spleen, and I'm going to recommend, you know, that one, if you want to use it later on and adapt it down to 17-year-olds to be for your peds class, that's fine. And the second case is an outpatient. So you want to get that case up in front of you. And then there are 2 templates. What those templates are is they are a template for writing the 6 questions. So I've given you a case to start, and I want you in your groups to see if you can go through and write those questions. There are 2 templates. I'm suggesting template 1 is going to be used for case 1. Template 2 is for case 2. Now, there is a place on the template to add information. I would get through, see if you can get through as many questions as possible. You don't really have to add that additional information until case 6 if you don't want to. So I wouldn't focus on the outcome right now. I would try to work my way through questions, and then if you have time, do that. Okay, feel free in your groups, if you think that the case needs to be modified, go for it. All right, questions before we break up into groups? Hi, this is Desiree Hensel, and I'm going to provide you with possible answers to the case studies we did from the November 5th session. The first case study, we used template number 1, and we did a case study for a ruptured spleen. Our case was the nurse cares for a 19-year-old male with abdominal pain in the emergency department. We had nurse's notes for our EMR to begin with. At 0900, the client has pain and tenderness of the abdomen, particularly on the left upper quadrant that radiates to the left shoulder. He reports taking 200 milligrams of ibuprofen before coming to the emergency department, which he said helped his pain slightly. He currently rates his pain 6 of 10. He also reports feeling lightheaded and appears diaphoretic. His skin is cool to touch. The client denies any recent injuries or blunt trauma. His history is positive for Epstein-Barr virus, diagnosed 7 days ago. T is 100.2 Fahrenheit, 37.9 Celsius. P is 94, respiration is 26. Blood pressure is 78/40. Pulse oximetry is 95%. So the first question is always a recognize cues question. In here, what we gave in the template was we asked you to make a select N question, and you could choose how many items that you would key correctly. Remember, when you do a select N question, the key is whatever number you ask them for should be the number of correctly keyed items. So here my question is, which 4 findings require immediate follow-up? Remember, you do have to have a minimum of 5 options and a maximum of 10. I have said that above, but when you actually give this to the student, you would delete that row so that that would not show. Okay, so I've put in 1, 2, 3, 4, 5, 6, 7 items. And I said immediate follow-up, and we want to pick the 4 top findings. And here I said pain because the pain characteristics are consistent with something serious. Skin because he is cold. Circulation, which could be heart, blood pressure, and pulse. And the perceptions of lightheadedness, because all of these things moving together are symptoms of shock. So that is how I did number 1. Again, there are other things and other variations that could be possible depending on how many things you wanted them to select. Number 2 is an analyze cues question. It's always analyze cues, and we're looking for patterns. So in this particular case, we're doing a multiple response matrix, and we could ask our students to edit. You would edit the conditions or delete extra rows. Here, I'm saying for each finding, click to specify if the finding is consistent with acute appendicitis, ruptured spleen, or pyelonephritis. These are all things that could create abdominal pain. And so these would be reasonable for students to differentiate what kind of things would go along with these conditions versus others. In the findings area, remember, you do need to have a minimum of 7 findings, maximum a minimum of 4, maximum of 7. So I would delete this before the student saw it and list characteristics. Now, the idea here is to list characteristics that this is showing up in the case. You know, what I've seen people do is list extra characteristics that are not referred to in the case. And while I will not say that's wrong, it's better that what you're really wanting the student to do is to read about the client and to make decisions on the client findings. So it's better to pull things that are presented in the case. Now, if you decide you want to add something that wasn't originally there, you know, certainly you can add another time point and add more data to support your case. So here I've done the left quadrant pain, and left quadrant upper quadrant could be a spleen, or it could be a left kidney stone, but we think of acute appendicitis on the right. Diaphoresis can be any of them. Tachycardia could be any of them. The blood pressure, we would expect it to go down if you had a ruptured appendix or a ruptured spleen. The kidney stone, we would expect it to go up. But the Epstein-Barr virus is pretty unique to the ruptured spleen. Remember, when you do one of these multiple response matrices, they have this note at the bottom that said each column must have at least one option selected. So that would be my second question. And because we would count this by rows, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. This one would actually have 11 points possible. Question 3, let me take it down to the next page, is an extended drop and drag. Remember, I can have up to 5 options here, up to 5 blanks. So again, before the student, well, this part the student wouldn't see question 3 anyway, but the lead in says drag from the word choices to fill in the following sentence. Based on the findings the client is most likely experiencing, and here the correct answer would be ruptured spleen. Delayed treatment could result in, and the correct answer would be shock. Okay, so now let's go on, and we are going to question number 4. It is a prioritize a hypothesis question. And I think we talked about, it's very typical come question 4 that perhaps it becomes revealed to the student what the diagnosis is in case they didn't get it right in the first 3 questions. So there's this feedback kind to get them back on track. But it also becomes one of the reasons why if you give a case to a student, it's really challenging to do it in a format that if they're allowed to go backwards, because they're going to change their question answers once they get to this question and realize what the right answer might have been. So we are going to do a multiple response grouping, which is a variation of a multiple response question. We have to have at least 2 rows in each group, but we can have more as long as we're consistent. So here I've told them the client has been diagnosed with a ruptured spleen. So there we have just revealed this. Select the anticipated orders from each of the following categories. Each category may have more than one potential order. So I've got an activity, you know, are they going to have can they have clear liquids or BNPO? Medications, and actually we do anticipate that they would get a pre-op medicine. So it is anticipated that they might get milazolam and a normal saline bolus for that blood pressure. And then monitoring, they don't really need a blood gas at this point in time because the saturation was fine, but we do anticipate that they would need a type and cross match because this, we anticipate that this client would be going to surgery. So this would be an example of something that you could do for number 4. Certainly, if you want to add more options to each category, you can. Just remember, you're supposed to keep them consistent. And if you have 3 in the first one, you have to have 3 in all of them. The next question is a take action question. And so what we are looking at is how the nurse specifically implements the plan of care. I am picking a highlight question for this one, and it is going to be a highlight text, but we have set it up in such a way that they would select entire rows. And this is something that is sometimes easier to do than to picking partial text out of a paragraph and when you're setting it up in your system. So here I have the nurse receives orders after the patient returns from surgery. Click to highlight the orders that can be assigned to an LPN. And so I have highlighted the orders that it's fine for the LPN to take vital signs every 4 hours, record the INO. They can give a PO medicine for pain, and they can do the incentive spirometry, but it is less likely that the LPN could give IV push morphine because that requires a high degree of monitoring when you give that because of the risk that the client might stop breathing. Okay, so we've got our take action. So now we will come to our last question, which is always an evaluate outcomes. What I asked the groups to do was to write at least a new nurse's note for this point in the a case. Now, you could have written a new nursing note at any point in time. You could have added more values at any point in time, but given the activity that we did in the short period of time, we wanted to just write something that would give us some data so that we could evaluate outcomes. So I'm putting a time lap in here, and we're now post-op day 1, and it's at 0800. And do remember, we are going to use military time. This is alert and oriented to person, place, and time. Skim is warm and dry. Left abdominal dressing intact and dry. Rates pain 3 on a 1 to 10 scale. Diminished breath sounds and crackles in bilateral lobes. Frequent coughing noted. Bowel sounds diminished in all 4 quadrants, and I've got T is 100.2 Fahrenheit, 37.9 Celsius, P 92, respirations 22, blood pressure 155 over 74, and pulse oximetry is 93%. So I have now set this up as a drop down rationale question, and I'm asking you to complete the following sentence by choosing from the list of options. And here we have the client may be developing which complication, and we would hope that they would recognize that the diminished breath sounds along with some of the respiratory issues are signs of atelectasis. And this is evidenced by, again, the breath sounds. So we used a template and we went through an entire case, 1 to 6 questions. This was just one example. I'm going to stop sharing this screen and I'm going to bring up the second case that we went through. So let me stop sharing this one. And we'll get the second case of the day. And here we are. We are in our case number 2, and we chose a different template for this. And again, you can use multiple different questions, but by using a template, we kind of organized our thoughts of way to move through the 6 questions. And it's a good way to get started. And it's not meant to be the only way you can do it, but it's meant to help you get started. And as you get more comfortable writing cases, you're going to take a lot more liberties with these and mix and match more freely. So this was a postpartum depression case. The nurse cares for a 33-year-old client at the 6-week postpartum follow-up clinic appointment. I have my nurse's notes. Now, I wanted to show the last clinic visit, and I did this here mostly because I wanted people to see the weight, that it was 150 pounds at the last visit. At the 6-week postpartum visit, the client is breastfeeding exclusively, taking her prenatal vitamin. She does not have lochia, and she has notes she has not had a period since delivery. She reports not sleeping, crying constantly. She is a single mother and states she feels isolated from family. She has a 2-year-old at home, but the father of the baby is not involved. She needs a note to go back to work and in next week and is still trying to find childcare. She feels like a horrible mother and she's lost half the weight she gained since pregnancy. I have vital signs as T 99.1, 37.2 Celsius, P 72, respirations that should be a RR, sorry about that, we'll put that in. 16, blood pressure is 92 over 66, and weight is 132 pounds, which is 59.8 kilos. Now, this was a highlight question, and I have said down at the bottom, click to highlight the findings that require immediate follow-up. Now, I put brackets around what I wanted tokenized. When the students first see this case, they're just going to see this without any words. I mean, without any kind of brackets, they just see the words. What I did by putting brackets around these words, which showed me options that they could pick from. They've been tokenized. And then I've shown you the 4 things that I thought were needing immediate follow-up: the not sleeping, the constant crying, feeling isolated, and feeling like being a horrible mother. So that is my recognize cues question using a highlighting text kind of format. The next question is my analyze cues. And this is when we're starting to look at the multiple possibilities and trying to find patterns. So I'm using a drop and drag, extended drop and drag, and I'm asking them to drag the word choices to fill in the blanks of the following sentence. The nurse should recognize the client is potentially experiencing, I have 2 options available here. And we would say the most likely would be the sleep deprivation and postpartum depression from the choices that we have listed here. Number 3, we take what we did number 2 and we refine it even more. I'm going to do a drop down and I'm asking the student to complete the following sentence by choosing from the list of options. And now I'm getting it down to the one thing. The client is most likely, and I've got experiencing postpartum depression, and delayed retreatment could result in risk of suicide. And what we would hope that the student is, when they look at the weight loss and that they know that it's really normal at 6 weeks that a client could have lost half their weight, that's not really an issue. And it's more sincere, and this is more, yes, the client is got sleep deprivation, but the biggest problem is the postpartum depression, and the sleep deprivation is probably contributing to it. Question number 4 is a multiple choice matrix. And here, remember, we need to have at least 4 rows, and we gave you a template and you told you to delete the extra rows that you didn't need. And I've got, for each intervention, click to specify if it is indicated or not indicated to include in the plan of care. So, and I'm going to put the not indicated over here. The potential intervention is postpartum depression screening, and yes, we would include that. Yes, does need a thyroid screening. It's very highly linked to postpartum depression. Should definitely have a mental health referral. We're not going to give a diazepam prescription. No, the client's not sleeping, but that particular medicine, the client is breastfeeding, and that would be not one we would give to a client who's breastfeeding. If we give something a sleep aid, there would be better ones to pick from. And we are definitely going to do some self-care education. So that is creating the plan of care or generating solutions. Moving on to question 5, this is a take action. So now we're going to get down to the nitty-gritty of exactly how we are going to implement the plan of care. And I'm asking the student, what should the nurse teach the client about the treatment plan? And we made it a select all that apply. In this, remember, we can have up to 10 options for this particular question. And so I put, it's critical to get 8 hours of sleep at night. Well, that's not going to happen because the mom's breastfeeding, so it's not realistic and it's not feasible. We want them to call immediately if they have thoughts of self-harm. As far as reducing anxiety, but keeping clutter home, the home clutter-free, we know that actually makes things worse when people set these really high expectations of perfectionism. When we want them to try to realize they don't have to be perfect. They should talk with about the problem with a friend or a loved one. They should try to engage in enjoyable tasks daily. Breastfeeding does not necessarily need to stop if they're prescribed an antidepressant. We have antidepressants we can use with breastfeeding. As far as limiting alcohol intake to 2 drinks per day, we would not recommend that. If they are going to drink, it would be 1 or less a day, and we'll try to probably continue to discourage that because it will probably interrupt with sleep and breastfeeding. But if they are going to drink, it should be 1 or less a day, and then connect with mothers who feel the same way. Then the last question, again, I asked everyone to go make a note that showed that there would be follow-up. In this case, we're going to add 2 weeks. We had a 6-week postpartum visit, so now we're going to add an 8-week postpartum visit. And here we said, reports taking prescribed citrulline for 2 weeks, has not attended counseling, continues to breastfeed, weight down 1 pound, 0.5 kilograms since last visit. Reports the baby seems like a stranger to her and she can't wait to get back to work so she can feel normal again. We've got our vital signs as 98.6, 37 Celsius, pulse 68, respirations 116, blood pressure 102/68, and weight 131 pounds or 59 kilos. We are going to use a multiple choice matrix. We do need 4 rows, but we can have up to 8. The client returns to clinic 2 weeks after receiving a prescription for citrulline and a referral for counseling. For each finding, click to specify if the finding indicates the client's status has improved, declined, or is unchanged. So we have in our sentence, we have referred to the 3 different choices that the student may pick from. We can say the breastfeeding really hasn't changed any, it's continuing, so we'll keep that as unchanged. The client continues to lose weight at an anticipated amount for someone who is recovering, so the weight loss is pretty much unchanged. As far as the sleep, that would be improved, but the mental health, the fact that the client feels like that the baby is a stranger to her is definitely something that is going the wrong direction and indicates that the status is declining. So that was an example of using a second template and working your entire way through a 6-question case. I hope this has been helpful to you, and good luck to you as you work your way through planning cases for your classes.